Mental illness is a part of most Australian families and households, as well as it was a part of mine growing up. When I moved to Darwin, I started going out to communities, working with different people, teaching people about mental health and well-being. And I guess that just grew as something that really was a need in the Northern Territory, knowing that there was such a gap in mental health education and how strongly I feel for us needing to know what is mental health, to have wellness in general and to look after our health, that I couldn't just leave this gap and do nothing about it. I set up 221 Mental Health Charity to be a place where people could get information and education to be able to have mental health conversations with anyone in their life. 221 is a reference to we have 2 eyes, 2 ears and 1 mouth, so we should observe and listen twice as much as we speak. When people come to have conversations about mental health, we quite often jump to problem solving. And what people really want is to feel listened to so that they can have the capacity to come up with their own solutions to what is the next step for them and their mental health journey. Everything that you do every day is mental health, and it should be a part of inductions. It should be a part of like what we learn in schools and what we learn in the workplace and how to relate to each other. A key part of mental health awareness and prevention is actually reaching our young people. They are the people who are the most likely to be impacted by mental illness, but also it's the time that we learn these skills of how to learn about ourselves and our emotion. It's the time that we are learning about how to look after our body and our mind. It's the time where we're learning so much. People saying that they've never learnt these skills in their life and they've used them within a few days of completing the course. Young people who say that they sought out help or sought out a counsellor after doing the sessions. Even people who've said that after doing courses that they've used those skills to talk someone out of dying by suicide. It's really important that we sometimes have to step out of our comfort zone and put ourselves into a place of uncomfort for someone else's care. With the right awareness and support around mental illness, we can start to see mental illness not as this thing of this illness that is separate to our health, but actually integrate it into our health systems. If you have anxiety, depression, suicidal thoughts, whatever it is, there is support for you, and we should all know what to do and how to support the people around us if they're having any sort of health problem.